सभी सज्जनों को नमस्कार। On behalf of Rashtriya Boudhik Manch (RBM), I extend a hearty welcome to the August gathering. When Corona pandemic is spreading its tentacles in successive phases, and there is no respite at the site, it is our doctors, health workers, and service providers who are working day and night to keep the casualties and inconveniences to the patients and general public at bay. Especially the doctors who are working tirelessly during these difficult times are messiah for all of us. As part of the series of programs organized by RBM during the pandemic, today we are organizing a panel discussion on Omicron surge, the best precautions and cure. We have with us a panel of eminent personalities to speak, rather guide us, to live a healthy life during the Omicron upsurge and beyond. I welcome our guest of honor, Shri Upendra Prasad Singh, Secretary, Minister of Textile, Govt of India, New Delhi.
Namaskar.
I also welcome one of the prominent speakers of today's panel discussion, Dr. Professor Ashok Kumar Mahapatra, VCSOA, former Director AIIMS Bhubaneswar and former Dean Research and Chief of Neurosciences AIIMS New Delhi. And finally, I welcome our another prominent speaker, Professor Dr. Sarman Singh, Professor and former Director of AIIMS Bhopal and former Head Clinical Microbiology AIIMS New Delhi. Once again, I extend a hearty welcome to you all. Now I request Sri Tapas Ranjan Parida, General Secretary of RBM, to give a brief summary of activities done by RBM since its inception in 2018. Before handing over the mic to Sri Parida, it gives me immense pleasure to tell the August gathering that Tapasji is a prolific social worker, activist, organizer, coordinator, and actively involved in many prominent social organizations of the country. By profession, he is an economist and presently working as analyst for East Asia Pacific, MEA, and SM region at Schneider Electric. Sri Parida and President of RBM, Sri Sangram Patnaik, are the pioneers for organizing all the programs of RBM and actively supported by the entire team of RBM. Now I request Sri Parida to give a brief on RBM. Tapasji.
Thank you so much, Shalendraji, esteemed guest, esteemed speaker, respected audience. Before speaking about the organization, just me add few word about the Shalendraji. Dr. Shalendra Kumar Swami, Joint General Secretary of RBM. He did his MPhil from JNU and PhD from MS University Baroda. He is a good scholar and researcher. Now teach in GGS Indraprastha University, Delhi. Toward the end of the 2018, a group of educated, dynamic, and like-minded persons working in diverse fields and respecting all work of the society get together and establish organization with the mission of the nation first, with the prime motto to rectify and enhance intellectual glory of Bharat. As a result, Rashtriya Boudhik Manch (RBM) established as a pan-India independent registered non-government, non-profit civil society organization headquartered at New Delhi. From its incubation, RBM has been working relentlessly not only in the intellectual sphere but also beyond the which include capability building and service delivery to despite and marginal section of the society. During the pandemic, the COVID-19, RBM with active member delivery around to 30,000 cooked food packets to needy people of Delhi, arranged online doctor consulting regarding the COVID also. Before pandemic, RBM has conducted candlelight match after the Pulwama incident where our brave soldiers are martyred. RBM has also organized 11 higher level intellectual panel discussion and talk in Premier Institute of Delhi like IIT JNU in physical mode during the pandemic. online mode. Topics of this discussion are mother tongue and nation building, emerging new world of orders, lesson from COVID, India-China face-off, many more. Prominent speakers who graced the panel discussion including Honorable ex-Union Minister Shri Pratap Sarangji, Union Minister Shri Viseswar Tuduji, former member of the Parliament, National Vice President BJP Shri Bajent Pandaji, Major General G.D. Bakshi, Dr. Ashok Mahapatra ji, Railway Secretary Shri Sushant Mahapatra ji, MSc Secretary Arun Pandaji, many eminent speakers from various fields. Based on a discussion outcome, we have taken up the issue with the concerned authority from their implementation. RBM family believe in collaboration and bonding in society, for which we have organized two Parivar Milan of like-minded people in Delhi. Due to Corona pandemic, we have organized program on online in or hybrid mode. Today, we are fortunate to have virtual gathering of intellectuals who are eagerly waiting to listen. Our honorable guest Sri Upendra Prasad Singh ji, honorable speaker Sri Dr. Ashok Mahapatra ji, and Professor Sarjan Singh ji. I do not want to barrier between honorable speaker and all of you. Now I request to the president of RBM, Sri Sangram ji, to manage the program further. Before handing over to Sangram ji, let me speak a few words about our president Sangram ji. He is a renowned advocate of our country, having a standing of more than 25 years in Supreme Court of India and High Court of various states, and a panelist in commercial and corporate law, practice in many TV debate, columnist, teach corporate law in prestigious university in India like Symbiosis and many reputed university. Over to Sangramji.
Namaskar and Jai Jagannath, and a good afternoon to all of you. Very kind of you, Tapasji, for this kind introduction of all of us. You know, today we gathered to hear the words of wisdom of two eminent and famous doctors who requires no introduction. I'll come one by one, and then of course to have the toast among ourselves. We have one of those very famous and well-known bureaucrat by the name UNC. You know, at times it reminds me that there are two sorts of doctors who cures the patient with their medicines and brain, and those who are actually cures the patient with their tongues. And here we have two doctors, rather they are the professors and the giant in their own field, who has the brain and the brawn. And this I have taken for the William Osler, the great physician, Canadian physician, and one of the founding fathers of Johns Hopkins University. So while going through the, the biodatas and the CVs of Professor Sarman Singh and Dr. A.K. Mahapatra, I was amazed to go through this 81-page biodata, Professor Sarman Singh, and I was asking my friends that how to put it in the 8 lines because there are 81 pages. So Mr. Tapas said, do whatever best you can do. I don't know whether I can justify by putting it in 10 lines because it is difficult to introduce you in these 10 lines, but still I'll try my best. And of course, our own beloved Professor A.K. Mahapatra, he requires actually no introduction. I can bet and assure in Odisha, right from the people who are from, the school students to the elderly people, each and everyone knows him. So but I have to do my duty a little bit of, properly. So I must go through few of the lines about the two eminent doctors, and as well as my own beloved. I can see the Honorable Secretary. I think he has joined by the name Anjali Nathani. That's great. That's great. So let me start with Professor Mahapatra. He was born in Puri on 29th December 1952. His father was Navkishore Mahapatra and mother Dinamani Devi. And he passed MKCG Medical College in 1970, where he completed MBBS in 1975. MSc, MSH Neurosurgery from AIIMS Delhi. From 1983 to 2017, he worked as a faculty neurosurgery at AIIMS Delhi. In 1996, March, he joined as professor, and 2004 as senior professor. He was appointed as the director of Sanjay Gandhi Postgraduate Institute of Medical Science, Lucknow in 2006, the director of AIIMS Bhubaneswar in 2012. He retired as the Dean Research, AIIMS New Delhi, after spending nearly 42 years at AIIMS. Currently, he is working as the Vice Chancellor, SOA University, Dean University at Bhubaneswar. During his illustrious career, he has worked as the director of SGPGI for 3 years, from 2006 to 2009. During 3 years, he had successfully completed more than 10 to 12 projects, started and completed 2 phases of SGPGI from 2006 to 2009. He was the founder director of AIIMS Bhubaneswar, started in 2012 from scratch MBBS, BSc, Nursing Honors, BG, DM, MSH, started in 4 years period between 2012 to 2016. He has also started BSc Honors Medical Technology at AIIMS Bhubaneswar, 2015. Only one line I can say, that he is the man behind the soul of AIIMS Bhubaneswar. In last 40 years, Dr. Mahapatra received many awards. I cannot count them in fingers, of course, because it is 65. Delivered 15 orations, received many lifetime achievement awards, a fellow of National Academy of Science, member of Academy of Medical Science. He started Neurological Surgeon Society of India, NSSI, in 2010 and became the founder president. He also started the Indian Society of Peripheral Nerve Surgery in 2011. And let me go back to why he is known in every nook and cranny of our state as well as in this country. He, along with a team of very proficient professionals, operated Jaga Kalia Balia conjoined twin operations. Successfully, both babies survived. Overall, 12 such operations done in the world from 1987 to 2017. It was first reported successful operation in India. He came back to Odisha and took over the director of AIIMS Hospital and established bone marrow transplant center, liver transplant center, advanced training college, pediatric center, trauma center, hematology center, etc., etc. During last 1 year and 3 months, lot of work done in COVID-19. So I would leave it to Dr. Mahapatra because this introduction probably will take the entire afternoon. I'm sure people would love to hear your words of wisdom than my opening remarks. So over to Dr. Mahapatra.
We have to share the screen scanning. And all the president, secretary, can we share the screen? The host has make it disabled. So we are not able to show the screen anymore. So all the president, secretary, and Mr. Swami from all the Rashtriya Boudhik Manch, it's a great pleasure that you are doing very well and you have involved yourself both socio-cultural, economic aspect of India and have been involved in large number of webinar of national and international standard. And today we are here and I also welcome to Dr. Sarman Singh. We know each other maybe more than 40 years or so, and he has also joined in this conference. Today we are talking about, I will talk about basically Omicron and its impact on the society. See, we have been all the time feeling bad that we have suffered through the COVID for last 2 years or so, and more than 375 million people in the world have suffered from the COVID. And if you look at India, 3.8 lakh, that means 38 million people have suffered in India, and about 4.8 lakhs people have lost their life. So if you look at what the pandemic has done to the world, it has made us sick mentally, socially, financially, economically, and educationally also. Our students, if it continue another 2 years, they will not be able to read. Psychologically, we are suffering from stress. Can you hear? Can you hear?
Sir, you can share your screen now. You become the co-host.
you can't see now?
Yes, yes.
Can you-
So you can share now. It is open for you.
Yes, sir. Yes, yes.
Sorry for the interference. Please.
Yes, please. The slide disappeared. We'll just. So I was telling that 375 million people have suffered in the world and 5.5 million people died. And if you look at India, we have 3.8 crores people have suffered. That 38 million people have suffered till today. And about 3 days back, it was 37 million and about 1 million COVID
Make
cases
it full
added.
screen, sir.
And we know that we are not the only sufferer. The entire world from north to south, east to west. And if you look at the entire world, then you see that the US is the maximum sufferer. Then the France, now France has daily COVID count of 4.3 lakhs. And if you look at that way, the more
Sir,
than
it
one.
is not full screen. Please make it full screen, sir.
Are you not seeing the full screen?
No, it is not coming, sir. It is in the presentation mode only.
Now?
Yeah.
No. We are able to see.
Now it is full screen, sir. It is
Okay.
fine.
I was only seeing the, so telling that how the COVID has affected the entire world. And in 1 day count of around 35 lakhs, this is what happened. US, France, Brazil, India, Italy, Australia, and more than 5 or 7 countries have more than 1 lakh. So it is not the problem for the India versus US or China or anything. We are all suffering from the world. And maximum daily count has gone this wave 3 of 3.82 lakhs in India. And we have today, if you see yesterday, about 300 or 400 cases less than day for yesterday, and about 400 people have died. So in India, we have 38 million people have suffered and 4.8 lakhs have died, which is a very big number. It's a big number. So we are not going to detail, but what is most important here, the cure rate, we have 99%, US has 98%, Russia has 97%, and in Omicron, which we are talking today, is started somewhere mid of November, but when the sequencing are done, it's 26th of November, we came to know that from Delta, Gamma, Lambda, and Alpha, we have Delta plus, then new strain has come in South Africa. In that new strain, there are a lot of mutations and lot of deletions. If you look at the protein of the Omicron, it has surface spike protein and core protein. And there is about 39 mutations in Omicron. And if you look at the number of Omicron cases, which these slides have to update it because this is 4 days back, it's almost now about 9,000 cases in India. And it is really a problem because we think that yesterday there was Karnataka 41,000, Maharashtra 48,000 and 30,000 plus in Tamil Nadu. All these things have shown that Omicron is very rapidly spreading and it has a lot of mutation. And only thing is that it has a 5 times more spreading capacity and 1/3 or 1/4 is dangerous. So it has a virulence about 70 to 60% of Delta. So it is only 3 or 4% people get to the ICU and very few people die. That is 0.3% death all over the world. So Delta is more severe. Omicron is mild. Omicron is 4 to 5 times is more. It is Tokyo University study. Omicron 4.5 to 5 times more infective. That means it can spread very fast, but it will not kill the percentage. But because the number of people, those are going to suffer huge, even small percentage. Yesterday in the world, about 38 lakhs people suffered from the Omicron or COVID, and 9,000 people died. And if this continue for 10 days, 9 lakhs will be 9 million in 10 days time. So the number of death is high because the number of infection is high. Otherwise, the oxygen consumption, ICU entry, number of admission is relatively almost 1/4 to 1/3. So why it is dangerous? WHO say that large number of people are not vaccinated. In India, 67 to 70% have got 2 jabs, and around another 10 crores have got 1. That means large number of people in India are not vaccinated. That constitute 300 million people below 15 years. They are not vaccinated. 330 crores of people in India are not vaccinated. They are below 15 years. And between 15 and 18 years, about 50% vaccinated. And we have got large number of hospital employees, those who have vaccinated 9 months back. That means when you took the vaccine in January and February, I took last vaccine in February, and the booster dose given in January this year. There's a gap of 11 months, which is a very big period. And we know from our experience, none of this vaccine is effective beyond 6 months. So if you want to give booster, you have to give when the antibody level come down to 0, and you don't talk about booster. So booster was given in America on 4 months and Europe in 5 months. So if you look at different vaccine, it produce different effect. And world say the vaccine can produce effect between 70% to 96%. But if you look at the vaccine like mRNA vaccine, their success or their antibodies stay about 4 to 5 months. If you look at AstraZeneca, that is what vaccine we have taken from the Serum Institute, and also Covishield and Covaxin, the infection or the antibody is going to stay for 6 months. So we know that beyond 6 months, all are like non-vaccinated cases. So what did the government of India say? It's not a common cold. Don't presume that Omicron is a common cold. It has a potentiality of 0.3% death. It spread 4 to 5 times much faster. And large number of people are still dying. About 8 to 9,000 people are dying in the world. Omicron, the current vaccine is not as effective in Delta and primary COVID. So if you look at the primary COVID vaccine started about 1.5 years back, that is November 2020, it is about 60% more effective. So the vaccine was a 90% effective, maybe has gone down in efficiency around 60 to 70%. So we have to understand vaccine is not effective. People are more susceptible. 0.3% mortality as compared to India 1% mortality. So the studies from UK said that it's a less virulent but more effective. And if you look at the Europe, yesterday there was more than 4.5 lakhs infection in France and more than 2 lakh infection in UK. So imagine the beds are not available in Europe and US. So don't take lightly that Omicron is just a cough and cold, nothing will happen. So this is the message the WHO had given. And diagnosis is not possible. If you take Omicron sample from the throat, it will be PCR positive. But Omicron is only diagnosed in genomic studies, because genomic sequence in DNA will show that it's a different pattern than Delta plus Lambda, Gamma, and Beta. So we have to understand, even you are COVID positive, we cannot prove you are Omicron or not Omicron unless. And why it is difficult to do the test? Genome sequencing requires labs, it is expensive, and require technical and skilled manpower, which you don't have in India. In Odisha, there is only one place, the ILS is doing the genome sequencing, nobody else doing. So it is very rapidly spreading in India. We have gone in a month back 6,000 cases to 3.8 lakh cases in about 15 days time. So it has very rapidly, and we are telling that death is very less. If you look at the death statistic yesterday, still 480 people have died in India. So it can be taken as small number, but if it goes on for a month or so, 40,000 or 30,000 people are going to die in India. So we should not take it very lightly that Omicron is just like that. It is 80% less likely that you require hospital admission, 70% less likely that you require oxygen or getting to the ICU. So it has still 30% risk, 1 in 3 risk that you have to go to the ICU, and 0.3% chance of dying. So rapid diagnosis is not possible. And that is the reason when you say stay at home, you have to follow all the COVID protocol. When we say the Omicron is less serious, It's just not require oxygen. It doesn't involve lungs. The oxygen saturation doesn't go down, but it can still infect large number of people. And more serious will be the people, those who are high risk, those who are not vaccinated, those who are already vaccinated long back, people with comorbidity, or people those who are working in a hospital. If you look at Delhi, in one day, 2,500 people, police people are infected. Every day, 300 to 400 doctors are getting infected. In our hospital, I'm not sure 30 or 40% doctors are infected or not, because we don't come out with the data. If you see the AIIMS Bhubaneswar, large hospital like AIIMS and all, if whatever friend I talk, they say we are all infected. So the question is that we have to be very careful. I'm not going to show you genomic sequence because these are science. So they are not effective. There is no drug against COVID. These are all, except the vaccine. Probably drugs are all eyewash and brainwash for the public. Monoclonal antibody, we don't know. There is no scientific evidence. It may work in 70%. One can argue if it's 70%, why not try? So we still depend on the social distancing, high quality mask, not ordinary kapda mask, ordinary mask, whatever it may be handkerchief, a towel, or a gamucha, what people use, a laborer use gamucha. No, that's not going to help you. If you have to prevent Omicron spread like Europe and America, you have to put proper mask. Even at home isolation, we should be honest and sincere to the points. So vaccine is not effective as it is in case of normal COVID or Delta. So we have to be very careful. Omicron can only work up to 60 to 70% cases. So what happened to Covaxin? Recently, the Bharat Biotech gave a statement that the Covaxin is very effective, but they did not say the percentage and data. Similarly, if you see Covishield, they say Covishield is also AstraZeneca's vaccine is against Omicron. What is the evidence? What percentage? How long it is going to work? Nothing. So these are all scientific data which have not been challenged, verified, or vetted. So we do not know what the company says, what the TV channels show, and what the reality ground. So we do not know Omicron is going to be affected by the vaccine or not. So it is going to again further reduce the job prospect, because the name of now the Maharashtra has gone to complete lockdown. Tamil Nadu, Kerala have got night lockdown. Yesterday, the LG has told weekend lockdown in the Delhi. They did not allow many things to happen. So we know that the economical slow recovery which is happening is going to further suffer. The people have become 25%, 30% people have become poor, and the average life expectancy in India has gone down by 2 years. Before the pandemic, male life expectancy was 69.5 years and female life expectancy was 71 years. Now you reduce 2 years because of stress, lower immunity, anxiety, poor nutrition, poor income, and poor health standard. So you know that schools are closed. So we do not know how the children are going to school, and their education is seriously affected. They're psychologically, mentally, and stress. Every children, parents, those who come to me in my OPD say, the children have become mad, they do not follow the parents, they are abusive, they are arrogant, and they are very, very temper tantrum. So the question is that Omicron has really damaged us. Whatever may be virulence, whatever seriousness it may or may not be, but we have to be careful. So what do? We have to follow again same thing. Same thing is what? Good quality mask, social distancing. Now I know every day there's a marriage and somebody say, okay, sir, only 100 cases. So 12 o'clock 100 cases, 2 o'clock 100, another 100 cases, 4 o'clock 100. So we'll call 400 people in 3 batches. So we are different people are not following the COVID protocols. So we are going to suffer. In conclusion, Omicron is a variety which is less virulent but highly infective. It's 4 times more effective. Whatever may be the infectiveness or seriousness of disease, it's going to affect the schooling, economy, mental psychology, family health, personal health, and overall is going to kill 0.3% of people, those are going to suffer. So huge number of people are going to suffer, and a small percentage of people are going to die. So we have to be very careful and follow all the COVID appropriate behavior. So it has a social impact, it is a health impact, it is a financial impact, it has job impact, and education of the children is very severely affected. I think, thank you very much.